I would like to welcome everybody to this Nigeria's panel session, which is going to be on building partnership across actors and sectors for better health in Nigeria. My name is Dr. Aminu Magashi Garba. I'm the coordinator of Africa Health Budget Network based in Abuja, Nigeria, and I'm going to be the moderator for the Nigeria session. I welcome all the participants to this meeting, and also to welcome also our panel speakers, which I'm going to introduce very soon. While government commitment and political leadership are key to driving change, they are more effective when supported by partners who can advocate for change, ensure participatory approaches to planning, and promote accountability for results and resources. This session will provide the opportunity for conversation among multiple stakeholders and partners in countries that have made commitments toward the PMNCH call to action on COVID-19. And the objective for this session is to generate dynamic discussions from a diversity of voices across a range of various groups and sectors, showcase the best practices of coordinated partner-led effort to support the realization of government commitments for women, children, and adolescent health. Permit me to introduce the four speakers from Nigeria, which I believe we have four distinguished speakers for this discussion. Dr. Salma Anas Kolo, Head of Department and Director of Family Health Department at the Federal Ministry of Health in Nigeria. Honorable Mohammed Usman, the immediate past Deputy Chair of the Healthcare Services Committee of the Federal House of Reps, and also currently the Chairman of National Advocate for Health. Mrs. Toyin Chukwudozie, the Head of Programs Education as Vaccine, and also the Partnership Adolescent and Youth Constituency Rep from in Nigeria. And the last but not the least, Rachel Abuja, Health Correspondent with News Agency of Nigeria, and also a member of the Association of Nigeria Health Journalists. These are our four distinguished speakers for Nigeria. I can already see Dr. Selma online. I can see Toyin. I can also see Rachel and also Honorable Mohammed Usman. And I've seen a lot of friends of Nigeria online from the USA, African countries, the UK, Europe, and so many other places, including Dr. Flavia, the head of the chair of the Ethics and Governance Committee of the Partnership. We welcome all the participants to this panel, and also please, at the chat box, you are free to drop your questions on the chat box as we go along in this discussion. Yeah, also equally, also you can write your name and your institution also at the chat box for everybody to see you. Distinguished speakers will have 5 minutes each to make their own opening contribution, 5 minutes each. Then we'll now later come back to take another series of questions. I'm going to call Dr. Salma to open the discussion as a government rep and also the Secretariat of the Nigeria Country Multi-Stakeholder Partnership Platform. Dr. Salma, you are most welcome. And I would like to ask you about the commitments that were announced by the government of Nigeria in December 2020. What are some of the institutional efforts that have already been undertaken to operationalize the commitments and also make progress towards delivery of results? So these are your initial questions. Please, you have 5 minutes to to go. Dr. Salma, please proceed and you can go ahead. Thank you.
Thank you very much, Dr. Aminu. It's a pleasure to be back talking again about issues of concerns that concern women, girls, and adolescents, as well as children in Nigeria. So I'm glad to mention that we've made quite a number of progress despite the COVID pandemic in the country towards improving the well-being and health of women and children in Nigeria. Part of the efforts we made, we have been burdened by the impact of COVID in Nigeria, which has caused disruption of essential services within the last 1 year. So we jump-started immediately and ensure that we safeguard and secure continuity of services in the country. So what we did was the Honorable Minister of Health immediately launched the RAMCA, which is the Reproductive, Maternal, Newborn, Child Health, Adolescent, and Elderly, as well as Nutrition, a multi-stakeholder coordination platform to ensure that we have synergy, harmonization, and leverage existing resources and also additional resources to make maximum impact towards the improvement of health and well-being of children in workers that are working and also managing them. The reproductive, maternal, newborn, and child health are also positioned within the coordination mechanisms of the COVID response during the period. We work towards developing essential health guidelines and then pregnancy care guidelines with COVID. We also develop PMV's guidelines. During the period, we're able to come up with what we call the RAMCA COVID response plan to ensure sustenance of essential services across board, across RMNCAH. We also reviewed our family planning blueprint and ensured that it captured COVID response and also emergencies, public health emergencies. And this was also launched last year, the family planning blueprint. I think one major thing we did also around policy was to ensure that we reviewed and were all encompassing, and it also considered COVID response and public health emergencies. So our government remained committed to ensuring that we improve the well-being of women and well-being of women and children. And this was clearly demonstrated through the commitments on family planning, counterpart funding. Despite COVID, government of Nigeria was able to meet the commitments of 2020, and it is also in the pipeline for 2021. We also ensured the release of nutritional support. So in addition, government stepped up response to ensure that vulnerable people, especially women and children and adolescents, and the elderly have access to quality essential healthcare services within their reach. And this was achieved through the Basic Healthcare Fund, which was released during the period, through the National Primary Healthcare Development Agency, aimed to strengthen the PHCs. And also another gateway was through the National Health Insurance Scheme. And a huge project was also launched last year, which is about the group and individuals and family health insurance scheme, which is another gateway that will ensure access and serve as a safety net to ensure access to quality healthcare services. Another gateway that we are currently working on is to the emergency National Health Ambulance System that will also ensure that women have access at the right time in the right place to deliver their babies when the need arises. I think one major step we have also achieved in terms of commitment to improve healthcare is creating a platform which is working with the legislators to come up with a bill on maternal death, perinatal and death review surveillance. So this is almost approved by the Honorable Minister and will soon be endorsed by the National Assembly through the Senate Chair on Health. So we've made quite a lot of modest progress in the period. Part of what we did under the partnership project was to leverage opportunities, especially through the private sector and also community involvement, who are the gatekeepers. I can't hear you. Are you talking? Okay, yes. Then we've also worked across sectors, not only health sectors, because we realized that health sector cannot deliver alone. So partnership was strengthened, especially with the Ministry of the Environment, where we step up the issues of sanitation and hygiene, personal hygiene, and also toilet systems, which is a barrier to access to services, and also water supply, as well as electricity, because the ministries that work around electricity also pick some PSCs to strengthen and ensure that electricity supply is available to primary healthcare facilities. So these are lessons we have learned working together as a result of COVID. But another important ministry I must mention is the Ministry of Women Affairs, where we work together around gender mainstreaming and also issues of gender-based violence, because we realized there was a surge of abuses, sexual abuses during the COVID pandemic, especially at the early stage of where we had the lockdown. And also we work assiduously again with the Ministry of Education to ensure that education plays a critical part, especially the girl child education and adolescent education. And these are some of the ways that we felt that it will greatly improve access to services around RAMCA, reproductive, maternal, newborn, and child health in the country. So in a nutshell, these are the areas that the government remains committed to achieving. And the Honorable Minister of Health has been leading on that in collaboration with all our key partners, including the civil society organizations, the private sectors, the religious and traditional institutions, professional bodies, especially the National Nigerian Medical Association, and also the Pediatric and the Obs and Gynae Association of Nigeria. They are critical partners in the new approach that was adopted by the health sector in Nigeria. So far, this is where we are in the country, and the commitment remains. And we look forward to more collaboration and partnership with our partners and the civil society organization as we step up our commitments to realize the vision of well-being and health of Nigerian women, to health of women, children, and also adolescents, as well as the elderly people. Thank you so much.
Thank you very much.
I hope I've not exceeded 5 minutes. 5 minutes was so little.
You have done very well. Yeah, thank you.
Thank
the
you,
government
Aminu.
has a lot to say. You are the secretariat of the country multi-stakeholder platform. A lot to elaborate. So we thank you for all this wonderful work you are doing. This is the mini partnership of Nigeria as compared to the global partnership. We heard so much from Dr. Salma about what the partnership is doing in the area of collaborating with different stakeholders, including young people, media, adolescents, NGOs, healthcare professionals, and also in a multi-sectoral approach, engaging Ministry of Women Affairs and also Ministry of Water Resources. I would like to now turn the discussion to Honorable Mohammed Osman, who is the immediate past chair, deputy chair of health services within the federal parliamentarian at National Assembly, and also chair of the National Advocate for Health. So he has a dual experience of the parliamentarian and also engaging with the advocacy. Honorable Mohammed Osman, you should omit your mic to respond to the question about how has the Parliament of Nigeria been involved in providing oversight for delivery of the commitments made by the government. You heard from Dr. Salma, she listed all the commitments. How is the Parliament in Nigeria getting involved in ensuring the oversight for this delivery? You have 5 minutes for this question before you come back for the round 2. Thank you very much, and you have the floor. Thank you.
Okay, thank you very much, Dr. Aminu, my colleagues, panelists, as well as members of the public, watching this program. Let me say from the onset that there are 2 major roles of parliaments all over, the world, including Nigeria. One is appropriation as well as oversight. These are key functions. And in whatever we do, we take these two things into consideration. I will want to answer the questions, the question by explaining 3 areas of oversight that we really engage on to ensure that there's value, you see, for money. The first, I would say, is oversight during pre-budget preparation. That is on an annual basis. Before the new budget session, there is always a review of the previous budget. Now, this review entails, you know, the parliamentarians going to the field, going to oversight the projects, the programs in the Federal Ministry of Health, as well as its various agencies, to ensure, to determine level of performance. What percentage of the budget has really been maybe recorded or achieved? Is it 60%? Is it 70? Is it 80? And if there is the performance is below, for instance, average, what really happens? The heads of agencies there during that interaction are expected to inform the parliamentarians of really what went wrong, or if there are challenges, what are the challenges? Now, immediately, you know, at times dependent on the engagement, if the parliaments are satisfied with the responses or with what they have really seen on the ground, then that may be okay. If they are not, then the chief executive, as well as their personnel, are invited to the House to further shed light on these areas that are maybe areas of discrepancies, and then members will have a good opportunity of asking further questions, further inquiries, in order to ensure that they are really satisfied. In other words, the main target of this oversight is to ensure that, to justify that you are ready for the next budget session. Now, the second area of budget oversight, which the legislature with the parliament, you know, does, is immediately after the budget. After the budget, maybe sometimes few 1-2 months, you know, can be given, you know, to the ministry as well as the agency. Then thereafter, members will also, you know, embark on physical oversight, you know, to really see to what extent has the budget been implemented. Here, for instance, one may want to really find out in the key areas, for instance, in the family planning budget, in the basic healthcare provision for nutrition or immunization, what is the level of budget implementation? The parliament, for instance, on the basic healthcare provision, as well as of funds to the Federal Ministry of Health, as well as to the agencies which are serving as gateways for the disbursement of the basic healthcare provision fund. And in particular here, we're talking about the National Primary Healthcare Development Agency, as well as the National Health Insurance, you know, Agency, to really find out the level of disbursement, how much has really been disbursed. Here, the parliament would want, you know, to ensure that the accountability mechanism which are put in place are really adhered to, they are monitored, and there is this track status of the status of disbursement, which are really examined thoroughly. Now, the last but not the least is also, you know, looking at the hospital, the infrastructure. Here, maybe the primary health care centers in the various parts of the nation, which are at the subnational, level. Members also here would want to really find out what is happening to the commodities, which are the commodities that each of the facility has on family planning, which are the, what is happening on the immunization, how many children are being immunized on a weekly basis, on a monthly basis, on a quarterly basis, on an annual basis. All the statistics, are usually made available, to the members. Then again, members would want to really find out about the drugs, the personnel, the facilities. How are these really, particularly the facility, the personnel? How many staff do we have? Do we have, for instance, a medical doctor? Do we have a nursing officer, a midwife, and what have you? All these are, goals, really to assure, the parliament, the members that the hospital is really providing value for the money really being spent. These are some of the three major layers of oversight function, which the parliament, particularly the committee that I know, Committee on Healthcare Services, usually goes through to ensure that there is tracking, there is proper monitoring, as well as supervision of the funds that are allocated to ensure that the poor health indices of the country are improved substantially. Thank you, Dr. Aminu.
Thank you very much, Honorable Mohammed Osman, the Chair of Advocates and immediate past parliamentarian in Nigeria. We heard from him the oversight function of the National Assembly cannot be overemphasized. Government to account, they engage the populace to ensure what is also going on at various layers at country level. So we'll come back to you at a later time to ask some follow-up questions. It is now time to invite the young people at the table. Toyin Chukwudozie, how has the youth community in Nigeria been mobilized to leverage the commitment for powerful advocacy? What have been the outcome of your partnership with the government to enhance community engagement mechanisms for community delivery? Toyin, you have been in this journey with the partnership for a very long time. And since November last year, we have been working together to promote synergy in Nigeria. So please omit yourself to respond to what has been happening with the young people involvement and also the outcome of your partnership with the government to enhance community engagement mechanism for community development. So you have also 5 minutes to respond to your question. Toyin, please, you have the floor. Thank you very much.
Thank you very much, Dr. Aminu, and thank you everybody for joining our session this afternoon. So really, the young people in Nigeria, we've been involved in the discussions around Nigeria's commitment to the COVID-19 call for action for women, children, and adolescents made by our government in December 2020. Last month, young people from across different parts of the country were mobilized to participate in a joint convening of CSOs and youth to review the commitments that Nigeria made to the global PMNCH COVID-19 call to action. And the commitments were shared at this engagements were shared with everybody, and we had discussions in details about the commitments that Nigeria has made. The reason was, of course, to get everyone present to understand what the commitments were and what the government was promising to do to improve the health and well-being of women, children, and adolescents in Nigeria. So there were discussions regarding our different roles in ensuring accountability of the government to those commitments. We also engaged senior government officials on those commitments, including members of the legislature, like Honorable Usman, who just spoke before me, and other members of the Federal House of Representatives who were present. And of course, we had conversations with young people about their role in ensuring accountability, including their oversight functions on what it should be over these commitments that have been made. So during the same meetings, we participated in developing the press statements that was shared on the World Health Day. So this year's World Health Day had a very powerful theme that resonated with young people because it was talking about, fairness. And so for us, it was important to contribute and put out a statement with other civil society organizations who contributed to say where we stand and what our position is regarding fairness and equity in healthcare service delivery, especially for adolescents and young people. And so we worked together with the other civil society organizations and contributed to that press statement that was put out to mark the World Health Day on the 7th of April. Of course, part of what our contributions to the press statement originated from was also the new information that many people had about the commitments, because the commitment was made by the government in 2020, but of course not many young people knew about it. So that was a very good opportunity to get down to the nitty-gritty of what those commitments were about, including the budgetary, the financial commitments. That's what I would say. The financial commitments, that went hand in hand with the policy commitments that the government had made. And so armed with new information, of course, we were able to put out a more sure-footed position in speaking to fairness and equity for healthcare service delivery for young people in Nigeria through that statement. During this engagement also, young people worked together to develop advocacy messages that would be used and targeted at government stakeholders regarding the commitments. We also worked on an advocacy strategy that we will also use to call on the government to implement their commitments. Some of those advocacy messages were already shared, starting with the World Health Day campaign. We shared on social media. We had a social media campaign those 2 days or thereabouts around that commemoration day. And of course, the strategy that we have developed is something that we intend to continue to deploy moving forward in engaging relevant government stakeholders at different levels to ensure that government follows through with their word, because participation in this convening was from across the country, and many of us are intervening or engaging in advocacy at different levels. Some are at the national level, some are at the state level, some are at the local government levels. And it was important to have this information so that in the different levels or at the different levels where we engage and with the different category of stakeholders that we're engaging, we have concrete information that we can use to engage them. And that's some of what came out from that advocacy strategy. For me and for many young people in that meeting, an important outcome for us was just that more young people are aware of these commitments, so that in our advocacy for improving adolescents' health and young people's health at different spaces that we are involved in and at the different levels where we are intervening and advocating, and even for the different categories of governance that we engage with, we would be advocating from a perspective of having, evidence, having accurate information to back up our advocacy, so that when we go to meet somebody to say this is not happening the way it should happen, it's from a point of knowing that this is actually what the government has pledged to do. And so having access to that information and that conversation that happened at a high level, but having it within our reach to help back up our advocacy was really very key and important, because for us as young people, these conversations should continue. And despite the fact that there are commitments and we know that the government is putting in efforts to make sure that everybody gets the healthcare service delivery that they need in a fair and equitable manner and environment, we still know that there are gaps, and we want to continue to use this commitment and use this opportunity to hold stakeholders to account to ensure that these gaps are filled. And this goes to not just the Ministry of Health at the different levels. We also want to be able to hold even the legislators to account, to say that they have to perform their roles also in terms of oversight over national level budgets, over state level budgets, and ensure that that the allocations that are going to these different aspects of health for women, children, and adolescents matches what the federal government has committed to doing. Where that we're advocating for all people who are after young people. This was an doing youth work in Nigeria to ensure that our common goal of improving the health and well-being of adolescents and young people is actually actualized. Thank you.
Thank you very much, Eva, and also a member of the PMNCH AYC. We heard from her. She mentioned some key steps and the youth and young people involvement in the country coordination partnership platform in Nigeria. We heard from her the young people have developed advocacy messages and strategies to engage meaningfully in the country. That is the way to go. We need to ensure the young people are on the table all the time in planning, in designing, in implementation, in tracking, in holding government to account, and ensure transparency. At every stage, the young people should be on the table, not only in getting the services, but also in all the discussion. I'm now going to turn the discussion to the media. Rachel Abuja from the News Agency of Nigeria and a member of the Association for Health Journalists in Nigeria, ANHEJ. Rachel, you are part of the Media Sensitization Summit that took place in Nigeria in March and April and May to inform media personnel about Nigeria's commitment to partnership call to action. Can you share with us what are the outcomes of that media summit and also what has been achieved since then after the media summit? So please unmute your mic and you have 5 minutes to share with us some of the key lessons learned, the achievement and the outcome of that media summit that you have been part of. Over to you, Rachel. Thank you. Please unmute your mic. Rachel, we can't hear you. Unmute your mic. Rachel? Rachel, you can hear me?
Let her come. Wait. Let her come and use my own. Let her come and use my own. Come.
Oh, can you hear me?
Come. Let her come.
Hello, can you hear me?
come and use my own.
We apologize for this small hitch. Should be coming back in the next 30 seconds, I guess so. Please bear with us. Thank you very much, participants.
What did he say?
Hello.
So can I ask a question? I'm from Liberia, member of parliament. Is it the right platform I'm on? Hello?
So, Honorable from Liberia, this is for Nigeria. I think you're not in the right room yet.
Hello?
Hello.
Hey, keep talking now.
Okay.
Talking.
Good afternoon, all. Good afternoon, all.
Good afternoon.
Use this one.
Good afternoon, all.
Right. Good afternoon. How are you?
Fine, thank you. This is Rachel from the News Agency of Nigeria. Now, the intervention for the media has potentially played a major role in the PMNCH call to action and the Nigerians' commitment. We now have an improved reportage. We utilize a variety of media channels to inform, persuade, and motivate all stakeholders on the PMNCH call to action and the Nigerians' commitment. The media is now influencing the PMNCH call to action in the country because of better understanding through the capacity building section on the PMNCH call to action. In addition, a COVID-19 financial accountability working group has been established where myself and 3 other journalists are on the working group. We have the radio expert, television, and online media print. Thank you very much.
So, Rachel, can you hear me?
Yes, I can hear you.
Okay, so can you let us know what have been some of the amplification of the call to action and Nigeria's commitment in Nigeria in the media? Has there been any reports or coverage or activities? Can you share this for 1 minute? Some of those success stories. Thank you.
Yes, we now have an improved reportage on the call to action and also the Nigerians' commitment. Recently, the Ministry of Health had a press briefing with all the media houses in Nigeria, where all media held were involved, and we had a beautiful dialogue. And we now have a better relationship with the parliamentarians. We have a better relationship with the health sector, and of course, Nigerians are now fully aware of the PMNCH call to action and the Nigerians' commitment. Thank you very much.
Thank you very much, Rachel, from the News Agency of Nigeria, and we apologize to our distinguished and esteemed participants for the hitch. We're happy that she has shared some of the experience. The media have been very proactive in Nigeria during the World Health Day in the country in April. We had a record of over 50 publications and news coverage in Nigeria just for one single day event. The young people, the NGOs, and the media working together. So that has been a very good activity, and we are happy the media are on the table, not only in reporting, but also part of planning and also implementation and holding the government to account. As you are aware, in December 2020, Nigeria's Minister of Health announced over $2 billion financial commitment on the call to action to the PMNCH, ranging from funding for nutrition, funding for immunization, funding for basic healthcare provision fund, funding for the family planning commodities, and also funding to also address the cross-cutting area of ensuring midwives and healthcare workers are in the facility during the COVID-19. The government has launched 2 government policies this year to support the call to action: the 1-year operational plan of the country platform, and also the RMCAH continuity plan during the COVID-19. These are, success stories that were all amplified by the media. So I would like to do a follow-up question to the panelists, and also I'll be checking your chat box in case participants have questions. Please drop it on the chat box, and we can actually appropriate the question to the right partner. So we have questions from Ahmed Abdul Salam on the chat box from the Nigeria Youth Champion for Universal Health Coverage. He mentioned that CSOs and the young people should be fully supported in every state to monitor the release of funds of the basic healthcare provision fund. And also he mentioned that accountability shouldn't be left alone to government alone. I would like to hear from Honorable Mohammed Osman whether that assertion is correct, and that the accountability should not be left to government alone. What has been the experience in Nigeria in driving the accountability agenda? While we are waiting for Dr. Salma to come back to the meeting, I would like Honorable Usman to comment about this issue of accountability shouldn't be left to government alone. Who are the remaining stakeholders that should be on the table? Honorable Usman, please, you can unmute your mic and speak to the question. Thank you.
Okay, thank you very much, Dr. Aminu. What I want to say, based on experience and what I know happens, is that issue of accountability shouldn't just be left, with the ministries. In fact, every citizen is very much involved, on this. The CSO, civil society organizations, the media play key role, as well as even at the community level. Because, for instance, when it comes to basic healthcare provision fund, you can get to hear, the functionality or otherwise of a primary healthcare center from the community. So the communities are also, involved. And as much as possible, we try, to enlighten, to ensure that every citizen key in, because issue of accountability is not just one person, it's not just one agency, but it's almost everybody. Everybody has a role, to play. And that's why we encourage, citizens, to be aware of the disbursement, for instance, and the basic healthcare provision fund, how much has been disbursed to each state, how much has been disbursed to each local government, how many of the facilities, primary healthcare facilities, are beneficiary of the funds, what and what, so that way everybody, the citizenship will really key in, and there is usually a feedback so that to ensure that there is a value for money. That is what I want to respond. That's my response, to that question, Dr. Aminu.
Thank you very much, Honorable Osman. I'm glad and we're happy that Dr. Salma managed to come back to the meeting. We know all the commitment we are all making in the developing countries due to internet challenge. So we're happy that she's back. Dr. Salma, there are some questions already laid down for you. And I'm going to start with the first one about the issue of regarding to what would be your acts, your major acts to the PMNCH and the global partners. You are a government rep. You are the secretariat of the country multi-stakeholder partnership platform. So what is your major acts to the PMSC and also the global partners that are listening to us in this forum before I ask you the second question.
Thank you, Aminu.
From chat box. Mr. Selma, you can
Thank you,
unmute your
Aminu.
mic and respond to that question. Thank you.
Thank you, Aminu. Let me quickly respond. As you have said, we've just launched one of the largest platforms on reproductive, maternal, newborn, and child health in the country by the Honorable Minister of Health last year. And the overall aim is to improve the well-being, to traject the ugly narrative that we have around maternal deaths and child survival, and to see how we can harness available resources, leverage new opportunities, and achieve and maximize impact. So the major acts I would say is for the global PMNCH and global partners to support us to ensure that partners align to the new focus so that we work together as one and avoid working in silos, which creates a lot of duplication and wastages of resources. So we want to plead on that in helping us to align together. And then secondly, we want them to support us in the operationalization of the RAMCA, because we have we have already developed an operational plan, which was also launched about a few weeks ago. So we want partners to key into the operational plan and through the Secretariat, the global office to support us in terms of in the area of operationalization, because they are not duplication of what already exists, but there are major gaps that have been identified as major bottlenecks that affect progress towards reducing maternal deaths and also improving survival of children in the country. So these are the two major areas that I will ask for. And then thirdly, if I'm allowed to ask the third one again, is to say that we have also rolled out and developed a RAMCA operational RAMCA COVID response plan. And that is an area also we need support in terms of rolling it out, not only at the national level, but also at the subnational level up to the lowest level of implementation. So these are the three major areas, but I will not end without saying that we already have a roadmap aimed to reduce maternal and newborn deaths in the country. And that roadmap is still very valid. And we're looking forward to PMNCH's Global Secretariat support and all other partners to help us to implement that roadmap. Because I believe if we do that, it will be a strong game changer for us. But lastly is to say that we want support in the area of family planning. I know that COVID is changing the support we are receiving. It's also reducing the funding support, especially to our partners, UNFPA. I'm also pleading for more voices, for more advocacy to continue to support family planning, commodities, and logistics in the country, in as much as the Nigerian government is fully committed to it, not only at the national, but we are beginning to see commitment at subnational levels. But we still need an intensive and a high level of commitment from our donors, from our partners, because family planning, without underestimating it, is a game changer, it's a lifesaver, especially for the lives of women. And also it has its own impact on survival of children and the overall well-being of the family. Thank you so much.
Thank you, Dr. Salma. Before I allow you to go, in just 1 minute, please, there's a question from the chat box on involvement of water, sanitation, and hygiene as part of the RAMCA and also COVID-19 response. Could you tell the participants what the platform is doing to bring the WASH community into this conversation in 1 minute before I move to the other speakers? Thank you.
Thank you, Aminu, and all our viewers. I'm happy this was raised because we realized that one of the major barriers to accessing services, especially at our primary healthcare level, where majority are expected to access services, is lack of water supply, and the lack of hygienic toileting facilities, lack of security, and lack of electricity. So ab initio, at the beginning, when we established RAMCA, one of the major stakeholders is the Ministry of Water Resources. So the idea is for us to have water resources, sanitation, and hygiene as an integral package, part of the package of delivery of the RAMCA services. And I'm glad to mention that within the Department of Public Health also, we have created also a DEX officer responsible also for liaising with the Ministry of Water Resources and Hygiene, as well as within the Department of Family Health, we have the Health Promotion division that is responsible for that. So I'm happy to say that the Ministry of Water Resources was at the launch, and they've also attended all the technical working group meeting, and they are currently working with us. So as I mentioned earlier in my presentation, even through the Ministry for the Rural Electrification, they are already identifying PHCs to support them with electricity, as well as the same thing happening now with the Ministry of Water Resources. We're trying to see how we can leverage development agency led by the ED himself, see how they can improve sanitation and water and able to respond appropriately. Can you hear me? Am I offline?
Yes, we can hear you now. Yeah.
Yes. Okay. Did you hear the last part of it?
Yeah, you can wrap up the question. Go ahead. You can wrap up the
So yes, what I said is yes, Ministry of Water Resources is a critical partner and a member of the RAMCA platform. They are also a critical partner of all the technical working groups, and we are working closely with them through the Department of Public Health, where we have established a DEX officer there responsible for liaison, and also through the Department of Family Health, the Division of the Health Promotion. So the whole idea is to ensure that we have as an integral part of the RAMCA and nutrition, improve water sanitation, toileting facilities, clean water for women, because we have identified ab initio it's a major barrier that does not allow women to access services within PHC. Culturally, Nigerian women, as soon as they deliver, they want to have a warm bath with water immediately. So that is a critical barrier that needs to be addressed. And also privacy, toileting facilities. So we are working together under the platform to ensure that we address those issues, especially now that we have the National Primary Healthcare Agency also partnering closely with them to ensure that they strengthen the PHCs with those facilities. Thank you.
Thank you very much, Dr. Salma, for responding to this WASH. As you are aware, in the partnership COVID-19 call to action, involvement of the WASH is among the 7-point agenda. So we need to also bring it to the table. Ministry of Water Resources, Environment, and subnational government to also support this partnership. I would like to go to Toyin quickly. We don't have a lot of time, but we can still take 1 minute from Toyin. Please unmute your mic. Let us hear your last takeaway about how do we promote the mutual accountability. We had so much from the Nigerian team, very wonderful achievements, a lot of activities ongoing. So how do you promote mutual accountability within the country multi-stakeholder partnership coordination platform? Toyin, please, you can unmute yourself and you can share your thoughts. Thank you.
Thank you, Dr. Aminu. So we cannot overemphasize the importance of involvement of young people in all of these conversations and engagements, whether they are happening at the national level or happening at the state level. It's important that the people who these services are for are part of the conversation, and that they can tell you what their needs are, so that it's clear that what the government is doing is addressing those needs. It's not just about developing developing good plans and policies. It's also about hearing directly from the people who are most affected what exactly their needs are. So involvement, meaningful involvement, not in a tokenistic manner, but in a way where you really want for their voices to be heard and for their voices to count. In the multi-stakeholder platform, it's important that these conversations, it's continuously involving young people, and not only when we feel that the issues of young people will be discussed. So it's important for them to be part of the accountability mechanisms, the monitoring and the evaluation, even at the levels where in the communities there are plans and frameworks for communities to monitor what's happening at the PHCs. It's important for young people to be part of that process, whether we're talking about the World Health Development Committees or we're talking about any special committees or groups that are set up to monitor implementation. Young people should be involved at every stage of the conversation. Thank you.
Thank you very much, Toyin. We are going to wrap up this session so we can all go back to the plenary and hear the takeaway from the media. Rachel Abuja will be at the plenary session to give a takeaway from the Nigeria, what we have achieved today. I would like to thank everybody, especially our esteemed participants, for staying all through this important discussion about the Nigeria Partnership for Action, partnership for advocacy, for accountability, and also for engagement. 200 million population in Nigeria, with a federal government and 36 subnational government coming together to promote a dialogue and a partnership. We had the major acts from Nigerian government to the partnership. The acts of the government require a lot of technical support, a lot of alignment, a lot of coordination. So we hope to hear from the partnership at a later day and months in this year, how PMNC will come to Nigeria to provide that technical support, including financial support where it is needed. With this, I would like to thank everybody, our distinguished four speakers. You have done so well. You are committed, you are passionate, and we are very happy that you have joined this meeting today to talk about the Nigeria and the partnership we are doing at the local level, which will galvanize action not only at the local level, but also at the global level. Thank you very much. And God bless everybody, and wish you also all the best as you continue the journey in this summit and also beyond the summit. Thank you and bye-bye. Thank you.